A woman stands in her kitchen when a car alarm goes off outside. Within seconds, her entire body locks rigid, back arched, arms pulled tight against her sides, jaw clenched. She doesn't fall. She can't move. She is fully conscious, fully aware, trapped inside a body that has frozen solid in response to nothing more than a loud noise. For 5 years before her diagnosis, doctors told her this was anxiety. It wasn't. This is stiff person syndrome, an extremely rare autoimmune disease so uncommon that it affects roughly 1 person in every million, and so frequently misunderstood that most patients spend years being misdiagnosed before anyone identifies what's actually happening inside their nervous system. Picture a quiet living room, evening light through the curtains. A man sits perfectly still in a chair, his hands gripping the armrests, knuckles pale. A clock ticks somewhere nearby. He is waiting, not for anything specific, but for the spasm building in his lower back to either pass or take hold completely. He has learned to recognize the warning signs. He has not learned how to stop them. Stiff person syndrome was first formally documented in 1956 by 2 physicians, Frederick Mursch and Henry Waltman, who described a series of patients suffering from progressive, fluctuating muscle stiffness, primarily affecting the spine, abdomen, and thighs. For decades, it was simply called stiff man syndrome. The name changed. The disease did not. At the center of this condition is something the body relies on every second of every day without anyone ever noticing. A delicate chemical balance that allows muscles to both contract and release. The key player is a neurotransmitter called GABA, gamma-aminobutyric acid, which inhibits excess nerve signaling and allows muscles to relax after they've been used. In stiff person syndrome, the immune system mistakenly produces antibodies against an enzyme called glutamic acid decarboxylase, or GAD, which is essential for producing GABA in the first place. Without enough GABA, the nervous system loses its ability to tell muscles to stand down. The result is muscles that fire and stay fired, rigid and locked, with no normal release. What's particularly striking about this mechanism is how localized and specific the damage is. This isn't a disease that affects the brain broadly the way some neurodegenerative conditions do. It targets a single, precise biochemical pathway, and yet the consequences ripple through nearly every voluntary muscle group in the body because that one inhibitory signal is so fundamental to ordinary movement. A close shot of a hand attempting to release its grip on a glass of water, fingers trembling with the effort of trying to relax muscles that simply won't respond to the command. What makes this disease especially cruel is what triggers the spasms. Sudden noise, unexpected touch, cold temperatures, emotional stress. Even something as ordinary as someone walking up behind a patient unannounced can be enough to send their entire axial muscle structure into violent, involuntary rigidity. Patients have described the sensation as feeling like every muscle in their torso and limbs locking into a single, unbearable cramp simultaneously, sometimes severe enough to cause falls, since they often topple rigidly, unable to bend or catch themselves. In recent years, stiff person syndrome reached wider public awareness after a prominent musician revealed she had been living with the condition, bringing visibility to a disease that, until then, most people had never heard of despite its profound impact on those affected. That public attention helped many previously undiagnosed patients recognize their own symptoms for the first time, after years of being told their condition was something else entirely. One widely documented case described a 50-year-old woman with 5 years of progressive gait and balance difficulty, repeatedly evaluated and dismissed across multiple specialists, before imaging and antibody testing finally confirmed stiff person syndrome. By the time she was accurately diagnosed, she had become bedbound, unable to sit upright or flex her legs without triggering severe spasms throughout her lower body. 5 years. That's not unusual for this disease. It's closer to the norm. Another documented case described a 46-year-old woman whose earliest symptoms were misread entirely differently. Recurrent episodes of sleep paralysis, daytime exhaustion, and choking sensations at night, initially investigated as a sleep disorder. Only after months of testing, including overnight monitoring that ruled out sleep apnea and narcolepsy, did clinicians consider an autoimmune neurological cause and identify the antibodies confirming stiff person syndrome. These cases illustrate something researchers now consider central to understanding the disease. Stiff person syndrome rarely announces itself clearly. It tends to arrive disguised as something more common, more familiar, and far easier for an overstretched medical system to assume is the simpler explanation. A dim hospital corridor, the soft hum of fluorescent lighting, A wheelchair sits outside a closed exam room door, unoccupied, waiting. Behind that door, a patient is once again explaining symptoms that, on paper, sound exactly like anxiety, exactly like a panic disorder, exactly like something psychological rather than physical. This overlap with psychiatric conditions is one of the central reasons stiff person syndrome takes so long to diagnose. Sudden muscle rigidity, triggered by stress, looks, to an untrained eye, remarkably similar to a panic attack. Patients have been treated for years with anxiety medication, sometimes even referred for psychiatric evaluation, before anyone runs the specific antibody test that can confirm what's actually happening at a cellular level inside their nervous system. The disease frequently appears alongside other autoimmune conditions. Type 1 diabetes, autoimmune thyroid disease, vitiligo, and pernicious anemia have all been documented in patients with stiff person syndrome, suggesting a broader pattern of immune dysfunction rather than an isolated, unrelated condition. There's also a documented paraneoplastic variant, where the syndrome emerges as an early warning sign of an undiagnosed cancer elsewhere in the body, meaning that in some cases the stiffness arrives months before doctors discover the underlying malignancy driving the immune response. In these paraneoplastic cases, the antibodies involved often differ slightly from classic stiff person syndrome, frequently targeting a different set of proteins associated with specific cancers, particularly breast, lung, and certain lymphomas. Identifying this variant correctly matters enormously, since treating the underlying cancer can sometimes improve the neurological symptoms as well, making early, accurate diagnosis not just about managing stiffness, but potentially about catching a life-threatening illness years before it would otherwise be found. A wide, still shot of an empty physical therapy room, mats lined along the floor, a single wheelchair parked near the door. The room is quiet, waiting for a patient whose muscles, today, refuse to let her stand long enough to use it. Treatment for stiff person syndrome typically combines medications that boost GABA activity, such as benzodiazepines, alongside immunotherapy treatments like intravenous immunoglobulin, aimed at calming the misdirected immune response itself. For many patients, these treatments meaningfully reduce the frequency and severity of spasms, though most require ongoing, often lifelong management rather than a single cure. Some patients also benefit from plasma exchange therapy, which directly filters the harmful antibodies out of the bloodstream, offering temporary but sometimes significant relief during severe flare periods. Physical therapy plays an important supporting role as well, helping patients maintain whatever flexibility and mobility they can between episodes, even though therapy itself can occasionally trigger the very spasms it's meant to help prevent, requiring an unusually careful, gradual approach compared to physical therapy for almost any other condition. What makes stiff person syndrome so disorienting for the people who live with it isn't only the physical rigidity itself, it's the unpredictability, never knowing whether a doorbell, a cold breeze, or a stressful phone call will be the trigger that locks their body solid in the middle of an ordinary afternoon. For a condition affecting roughly 1 person in a million, it remains one of the most physically and psychologically isolating diseases in modern medicine. A body turning, without warning, completely rigid against its own will. Many patients describe a particular kind of vigilance that becomes part of daily life, constantly scanning a room for potential triggers, avoiding crowded or loud environments not from anxiety, but from learned, justified caution. Loved ones often adapt alongside them, learning to move predictably, speak softly before entering a room, and recognize the earliest, subtlest signs that a spasm might be building before it fully takes hold. It is, in its own quiet way, a disease that reshapes not just one body, but the rhythm of an entire household around it. This has been a real, documented autoimmune neurological case. Every detail in this video is sourced from peer-reviewed medical literature and confirmed clinical case studies. Dark Diagnosis Files investigates the cases medicine still struggles to explain. Every Thursday and every Sunday. Real, documented, told with the gravity they deserve. New cases every Thursday and Sunday. Subscribe. Your body is stranger than you think. Somewhere right now, someone is listening for a sound that might lock their body solid. They have no way of knowing when it will come.